Hi, I'm Rachel, and I'm going to be talking about prescription drug misuse, abuse, and addiction, and the environmental and cultural factors. Hopefully, I can get this to work fine. Okay, so media. Let's talk cultural environments about the media. So, how prescription drug abusers and misusers are portrayed in the media is that it's kind of both positive and negative. Um, the media does portray numerous TV series and movies that portray prescription drug abuse in both a positive and negative light. So, positively, they are having the ability to normalize talking about their struggles, getting help, and positive advertisements about getting help. Real life stories from people about their journey and recovery can be very beneficial. Social media has been helpful in reaching those who struggle with prescription illicit drug abuse who may not seek help on their own. Numerous organizations who use social media to educate on the dangers of prescription drug abuse, and it's a great way to get information out to the masses. The negative part is the media does not always portray prescription drug abusers in a great way. Advertisements can lead people to experiment, cause shame or embarrassment towards their actions, and feed into their addiction. Social media is one of the most detrimental factors behind the why and how of prescription drug abuse and what begins the cycle of drug abuse. Family support. So both the presence and lack do influence them. So the presence of it, studies have shown that families who talk about the dangers of drug use, their teens are less likely to experiment with drugs. Presence of support and concern for the individual's well-being is helpful, and open and safe communication between the family and individual those are just some of the positives in ways that the presence of family support is helpful. The lack of family support, countless prescription drug abusers started by taking leftover prescriptions in their home as a teenager or from other family members. Teens are more likely to experiment if no parental figures are around, which leads to drug abuse in their adult lives. Patterns of a family member being addicted to drugs can negatively influence them. Obviously, the lack of family support is a negative thing. The role of peers. So talking about peer pressure is seen a lot in adolescents and adults, but it's often more destructive and detrimental to the individual because that's kind of how they get started, and that is how they um, get hooked on drugs. But then you also have the role of peers in like a support group or meeting that can be very supportive and helpful. I sat in on a Zoom call of a prescription drug abuse meeting, and they had all been friends they met each other in the group and they had been friends and really relied on each other for years. And it was actually super cool to see um, how peers can be supportive and helpful, because I think a lot of times we think of peers as having a negative influence, but there are situations where they do have a positive influence. Um, cyclic cyclical nature. There are recurring patterns of prescription drug abuse. Addiction does have room for relapse. And then there is a large component of genetics. The American Addiction Centers estimated about 40 to 60% of addiction is due to genetics. So it is important to remember that when treating patients with addiction that it can be a genetic component. Legal and political system. So there is a push for prescription drug abuse education and recognition, both in the statewide, nationally recognized, as well as help for nurses who are addicted to prescription drugs. Like I said, there's organizations and programs, and then one of them that I wanted to mention was the naloxone program in Utah. That there are certain um, pharmacies that you do not have to have a prescription to obtain a prescription for naloxone. I had a nursing school instructor who she told us that, and she said it was one of the biggest things that she did was that she just went and got a prescription for it and she carried it around with her. I think she had like one in her home and then like kept like one in her car. So I thought that was pretty cool. So yes, in some ways that the legal and political system can be very beneficial for things like this. Potential barriers. We do see a lot of barriers when it comes to prescription drug abuse treatment. The cost of it, I was researching it, and can be from $1,500 to $60,000. Obviously, depending on the type of um, treatment the individual gets, and then definitely the accessibility, because prescription drug abuse is not just prominent in cities; it can be in rural areas as well, and so getting access to that treatment can be very difficult. But other potential barriers would include admitting that the individual has a problem and needs to seek help, religious beliefs, and stigmas surrounding prescription drug abuse. Internationally, prescription drug abusers are in danger regardless of the region of the world they're in. Um, I was kind of researching and it didn't really say that one place was more, at risk than another because prescription drug abuse can lead to risky behavior, STDs, illicit drug abuse, homelessness, lack of support system. Here in the US, we do have a huge problem, and our prescription drug abuse does, our opioid um, epidemic does fall under prescription drug abuse. But we do have countless programs, facilities, and rehabs all across the nation. Um, so that is pretty cool. So health disparities when it comes to socioeconomic status. Higher income is both positive and negative. They are probably going to have more opportunities and options to seek care. They can pay the higher cost for rehab, detox, inpatient or outpatient services, and they can get help faster due to the plentiful options that they may have. But they also may be able to obtain drugs easier because they're willing to pay more for them. And so you kind of an extreme would be celebrities become addicted to prescription drugs or illicit drugs, and prescription drugs do can lead to use of illicit drugs and heroin. So kind of just something to keep in mind. The lower income may not have as many opportunities considering the cost of addiction services. Some organizations do only cater to lower income or homeless population, and those are pretty cool, but that is their main focus. And then Medicaid does cover some addiction services. So that was, I thought, a cool thing that I found in my research. Race and ethnicity. So there's not a huge portion of data on this subject. There are high rates of prescription drug abuse in white and Hispanic individuals. Non-white minorities are less likely to be prescribed pain medication, I did find. So they may turn to other sort of modalities to obtain a prescription medication. In my research, I did find that Mexico, and I mean, I did know this, but Mexico sees a lot of illicit drug abuse, which I know falls under a different category because mine is prescription drug abuse. But it can lead to illicit drug abuse, and so I thought that was important to mention. Religion. So the positive and negative aspects of religion when it comes to prescription drug abuse. And then I want to talk a little bit about Utah specifically. So the positives would be they can educate on the dangers of prescription drug abuse, programs to aid in addiction recovery, and relief efforts. Um, so it can be very beneficial. Negative could be the shaming or teaching that addiction is evil or that you're not as worthy because you have an addiction. So kind of can come at both positive and negatively. And then I want to talk, Utah has a huge prescription drug abuse problem, and the LDS Church does have an addiction recovery program that has been very beneficial to those who I read had used it. But kind of the LDS Church teaches to not abuse drugs, and saying that Utah does have a large population of LDS people and those addicted to prescription drugs is just kind of something to keep in mind as well. And so yeah, so I mean, religion is not all positive or negative when it comes to prescription drug abuse and how to manage it. Gender. Um, Everything I found said that males are less likely to admit they have a prescription drug abuse problem. So they're less likely to get help, less likely to admit and recognize that they have a problem. And change that females are more likely to correctly identify their addiction and to get help. Other than that, there was not a lot gender specific on that. Geographical location, city versus rural areas. Obviously, the cities are going to have more services, more options, and telehealth would still be beneficial in a city setting, especially when you think of now as COVID is happening, how telehealth appointments would be very beneficial. Rural areas less healthcare facilities in general. They may not seek help or be able to obtain help as easy as they would if they lived in a city. And telehealth would be very beneficial to more rural areas. And I did see that the University of Utah is rolling out a telehealth addiction treatment program, which I thought was pretty cool, and I think could be really helpful to those in rural areas. Biases, so implicit drug seeking, failures, no good, unwillingness to get help. Explicit would be addiction is real, addiction is an illness, they need professional help, and you don't need to remember there is a genetic component there, or there can be a genetic component. I also came across an article that was pretty interesting that said wording makes a huge difference in those addicted to drugs, and it kind of had a chart of um, things, how we might talk about a person who has a prescription drug abuse problem, and kind of how we should change those words out. So I thought that was pretty cool. Internationally, so the data is very scarce on this information, which is also why I left the question up here. Are there regions of the world in which these disparities would have less influence on health for this population? And again, I didn't really find anything for this per se. These are my references, and I hope you guys learned some stuff about prescription drug abuse. Thank you.